Hi, good afternoon, and thank you so much for joining us today. We have an awesome conversation in store and an interactive one as well today. And I'm being joined by Brian Carter from Validic, and we have been partnering with Validic for several years now. They are just an amazing resource if you want to understand what cutting edge technology there is available to you as you manage population health, acute chronic care. And they really have a pulse on the industry and what's available, and have been true thought leaders as they start to aggregate that information and get it out to our members, and we've relied on them to do that. So now more than ever, these are really important conversations, and what's available to support you is changing every day. And so we are really excited for the conversation today. And as you guys are getting logged in, we'll introduce ourselves in a moment. But would love for you to draw your attention over to the GoToWebinar control panel. And you're going to find there in that control panel a questions feature. And so everyone's muted here today. And so we're going to use that questions feature to help you make sure that you get all your questions answered, because this is going to be a little bit more fireside chat style. We do have some slides to share with you. Brian's going to lead a conversation to kick us off here in a moment. But ultimately, this is for you, and this is for you to help make sure that you have access to the experts that you need to get your questions answered today. So if you could just, to get warmed up, find the questions box and put in the state that you are joining us from. Awesome. See them come in: Minnesota, Ohio, Texas, Illinois, Tennessee, New York, California. Awesome. Minnesota. I just was on a call with someone from Minnesota earlier. They said it was really gloomy over there. It's gloomy here too. Sorry, guys. Cool. Pennsylvania, Rockaway. Awesome. Well, thank you guys. That's just a nice little way for us to make sure we know who's on the call today and make sure you know where to type in your question. So thanks so much. And if you have any kinds of issues with audio or otherwise while you're on the call today, please feel free to let us know. You can let us know using the chat feature and the questions feature, and we can get some assistance for you. So without further ado, I'm Sarah. I'm the COO of WELCOA. We are a nonprofit organization. We've been around for 30 years, and our job is to train and educate and provide tools and resources for high-performing wellness strategies and programs and organizations. So we do that by being the professional organization worksite wellness. And so I'm being joined by Brian from Validic. And Brian, I'll let you introduce yourself to kick it off.
Great, thanks. My name's Brian Carter. I'm Senior Vice President of Product here at Validic. And Validic really is a company that's all about personal health data. So we help our customers, whether they're deploying wellness programs, remote patient monitoring programs, and everything in between, to tap into that whole ecosystem of personal health apps and devices, get that data into a manageable format, and get it into the systems and applications that they want to use to try to help people improve their health.
Awesome. So I know that we have a little bit of a presentation from you, Brian, so I can go ahead and get this rolling if you're ready.
Yeah,
you can just let me know the slides for you.
Yeah, so, I think always as a setup, I always like to share, the mission of Validic, which is, building on that concept of taking personal health data, and it's really about making it actionable so that people can make novel decisions, find novel insights, and figure out, what do I need to do next, whether it's to improve my overall health and well-being or to manage a chronic condition that I might be dealing with. And with the backdrop of COVID-19, if we want to go to the next slide, the metaphor that we kind of used as we started to look at the challenge in the country is, we almost said, the world is on fire and Validic has a fire truck, so we got to get out there and figure out how to help. And so, with our backdrop or background in managing personal health data, what we thought was, hey, is there a way that we can help employers, health systems, health insurance companies connect with all of their employees, all of their members, all of their patients, and track who might be developing symptoms of COVID-19 as quickly as possible. In an employer setting, that's really trying to identify who we ought to pull off the front lines so that we can limit the spread to other employees or our customers. In a health system type of setting, how can I keep track of people and make sure that we're using the medical resources that we have available in the most efficient way, making sure that people that can be monitored at home can be monitored safely, and the people that need to stay in a healthcare setting can stay in that setting. One of the interesting things for us was, this is not your typical scenario where, hey, it's going to be the new benefit year. We want to start thinking about a new wellness solution. We've got a few months to implement the software and train people. This was a everyday counts type of situation. And so, it really required a lot of kind of rethinking on both our business model as well as how we go deploy these solutions to be able to do that in a really rapid fashion, and happy to hit on that a little bit more here in a minute. But then there was this third bullet, and this was the one that for Validic, us as a smart device connectivity company, really hard pill to swallow, which was recognition that, the devices that measure the types of things that we really care about when we're tracking COVID-19 symptoms, those devices just are not available right now, at least the smart connected ones. Connected thermometers, connected pulse oximeters, the market is tapped. We have relationships with several of the CEOs of the manufacturers of these devices. We talked to one, and they said, yeah, my next pallet isn't going to arrive until mid-June, and the whole thing is already earmarked for a public health authority. So we also had to look at what's a different approach that we can take that doesn't rely on that typical super smart, super slick connecting all of these devices, that is able to be deployed really quickly and be able to get that data from a broad number of people without being dependent on those manufacturers. So if we go to the next slide, really what our focus was, and we'll hit a case study here in a second, was connecting to thousands of people and monitoring for those key symptoms. So how do I go reach out to every employee of my population and ask them to share with me, what's your temperature today? What's your breathing quality? What's your coughing look like? If you have something that can measure pulse blood oxygen saturation, what is that percentage? And then as the CDC continues to evolve their guidelines, continuing to add more things. Did you lose your sense of taste and smell? Are you having chills? All sorts of different symptoms that it's a very odd disease, and we're every week trying to keep up with the latest guidelines from the CDC on that. And then on the ease of use side, again, it can't be complicated. We can't have a 3-month implementation. We can't require connected devices when there are no connected devices. And then, this is something that Validic went and launched with our clients in a fashion that we wanted it to be as low cost as possible. Sure, we have a fire truck, we want to go help the world, but we do need to keep gas in the engine. But how can we deploy this in a way that's super low cost? We're not here to try to make Validic a wildly successful unicorn company by rolling this solution out. We really intend to help the world with this solution and really just kind of cover our cost on that solution. So if we can go to the next slide. So what the solution does in a nutshell is it sends a text message to every person in your population twice a day. They hit that link. It's a magic link. It's tied to them. So every person gets a different link. You don't have a username and password you need to remember, and it just asks you to report on those key symptoms that I mentioned, and we continue to evolve those. And then we float all of that up onto a dashboard that an HR team member, or in a clinical setting, a nurse, can monitor, and anybody who reaches a threshold on one or more of those symptoms floats up to the top, and we can very quickly reach out to that individual, figure out what's going on, give them the right advice. Do you need to go to the physician? Do we want you to keep just self-monitoring? Do we need you to hang up and call 911? And then we can track on all of those distributions, so then the HR team can get nice reporting, understand what's happening in their population, and then go back to monitoring the rest of the population. This literally can be deployed within 45 minutes. One of our clients, we got the entire thing stood up and trained their users within about an hour, and we're off to the races, keeping track of what's happening with people. And so my last slide here really quickly is a case study from one of our clients. Oh, did we lose the case study slide?
I think we might not have that one.
Okay, well, I will speak to the case
tell us the story.
Yeah, so Validic's based here in Durham, North Carolina, and one of our clients is a local market called Weaver Street Market. They're based in Durham, North Carolina. They're a grocery co-op. They have 300 employees, 4 different stores throughout the Triangle. And, you know, we got them stood up very quickly. And, you know, rather than sharing a lot of details about the implementation, I thought maybe I'd share a few of the lessons learned that they shared back with us. And one of the big things was, you know, this was an initiative driven from the top down by the general manager of Weaver Street. And, you know, the quote that the GM gave us was, "I don't want to look back and think we didn't do everything we could have done." And, you know, we've talked to some organizations, and I think this is a little bit of what we'll get into today, who, you know, might have some hesitation to be collecting health information from their employees, or impugning on their employees and asking them to do things that you wouldn't ever expect your employer to do. But, you know, Weaver Street, they said, look, at the end of the day, this is something that has never happened to anybody that's alive today. And, you know, what would I think if half of my employees suddenly came down with COVID-19 and that same mortality rate across the population hit my employees? So, you know, it was a decision they made from the top down very early that, you know, doing this part is part of their overall response. This is all being managed by their HR team, so they really manage the rollout, and more importantly, the adoption of doing the self-reporting of their symptoms every day. So the HR team is looking at the dashboard, looking for people who have not been reporting, reaching out to them, making sure that they understand the importance of it. And I think the way that they worded what they say to their employees about this was really interesting and really insightful, which is, it's not going to keep you well. It's about you doing this for your coworkers so you can help keep them well. And if you are feeling sick, we want to be able to pull you off the line as quickly as possible to help keep everybody healthy. This is not about you, it's about us as a team. And I thought that that was a really positive way that they presented that to their team. And then the managers in each of the stores are also being coached on how to provide encouragement and, you know, making sure that their teammates understand that, you know, this is something that we're all in it together, and, you know, again, being responsible to each other. And then obviously this is just part of an overall strategy that that they're deploying. In addition to the biometric monitoring, they're also, you know, providing and navigating people to both physical and mental health resources, giving a lot more flexibility on shift swapping. And, you know, there's an overall strategy of which this is a part, but they are kind of taking a whole person, whole team approach to managing, continuing to deliver an important service during our stay-at-home mandates. So that's just one case study. We also obviously have a lot of other clients, both in the health system and employer space, and, you know, they're all doing very similar things with the technology. But again, the technology is just part of it. It's an overall strategy that they've got to really manage across the company.
That's amazing. And just a few things, just that to respond to you on that, Brian. Thank you for sharing the case today. It's always helpful when people make it when those stories make it real, so you can kind of picture what exactly how someone would use something like this to help their employees feel more cared for and honestly to reduce risk and make sure people feel as comfortable as possible as they return to work. And I think actually that's probably a good segue, drawing that point out into, there's so many of us that have had the luxury of being, at home since this started. We are in front of our computers, my job, your job, for the most part, we are able to do from anywhere. But, for essential, workers, for those employers that have essential personnel, retail space, healthcare space, all of those who don't have that luxury, these kinds of resources not only are important right now, they're useful right now. And so those of us who are sitting there with remote workforces now trying to figure out how to go back to work, we're talking to HR people right now. That's who's on this call. So it's the people who've had to be the command and control center for the pandemic, for their workplace since day one. And now the new set of challenges is going to be, how do we return? And for some, we've had to think about how to manage this right now. So I'm curious, from your perspective, that's a great example, but do you have, what tools have you seen employers leverage? You're having to figure this out now because they have essential workers, just to keep their employees safe, that you think are well, and what do you think that we can learn from those that we can take away and start using as all of us return back to work, whatever that looks like?
Yeah, and this might be a little broader than just tools, but one of the things that I'll share that Validic is doing, and we didn't come up with this idea, we have looked across a lot of different employers, and we're launching either today or tomorrow a survey to our employee base, really trying to gauge both their overall attitude towards how important is it to aggressively get back into the office, even if we have to have very aggressive mitigation strategies in place, versus how many of them feel like, hey, I think we should continue to work from home until those aggressive mitigation efforts aren't required. But also going into more detail and taking all of the standardized recommendations that we're hearing from federal and state and local authorities around what to do in an office situation right now, and kind of enumerating those and saying, which of these do you think you'd have an easy time adhering to, and which ones do you think you would have a difficult time adhering to, and more interestingly, get their attitude on how they think their coworkers would answer those questions. Similar to the surveys you see where everybody thinks they're an excellent driver but thinks everybody else is a terrible driver. We see very similar responses in the population that I think I could stick with the mitigation strategies very well, but I don't trust my coworkers will. So trying to gauge that attitude, and really trying to understand before we get everybody back in, are you going to be able to actually do the things that we're asking you to do? I was actually on a call this morning with a very large national retailer and just talking to them about some of the things that they've had in place all throughout, because they are considered at least semi-essential type of retailer. And when you think about all the different types of employees that they have in place, they have people that are stocking the shelves, they have people that are working the cash registers, they have people that are going into people's homes to deliver some of their services, and you can't have a one-size-fits-all approach to those. When we think about doing temperature checks before somebody comes into your store or your office, well, what about your employees that are going into other people's homes and they don't really have a central place to check in? How are you going to keep track of whether they're doing those things? If you have dozens or hundreds of separate locations, what's the strategy you're going to use to make sure that all of those locations are adhering to the standards and the guidelines that your central office has put in place. So I'm not giving you tools as much as maybe some of the things as I've talked to employers that they've had to work through. And some of those specifics are probably going to be different depending on the way your organization is set up. Let me stop there. Maybe you have some stuff to add.
Yeah, no, I love that you started with surveying and asking, because I think so much of this is about not just transparent communication from the top down, but making sure that employees feel heard and feel like that their opinions are considered. And I know a lot of probably what's spinning in people's minds right now, and we were going to chat about this a little later and will, but is what of this stuff can actually do and not do legally, and I think so much of any of that is rooted in caring. Like, do your employees feel cared for? Are the steps that you are taking to meet their needs, are they pro-employee and pro them, or are they pro-employer, and in which case raises issues of fairness or privacy issues. And so I think starting with collecting feedback is such a good observation on your part, Brian. I totally agree. That one of the best tools that we can employ is just that we're being very human, communicating often and collecting information and ideas so that people feel like that they're coming back safely on their own terms.
Yeah, and I think it's interesting too, when you talk about making it about them and not about the employer, when you hear the governmental conversations, the political conversations about employer liability insurance, if people were to get sick, if they're forced to come back to work, I'm here to tell you, if your employees feel forced to do anything, they're going to find a way to force something back on you. And so the more you can make these things collaborative decisions, the more everybody's going to feel like a part of the solution and not a victim of something that's happening to them.
Yeah, absolutely. I love that perspective. And I want to pause and also remind our audience that if you have anything to chime in on any of these questions or anything in follow-up, we do have Q&A at the end, but feel free to go and get your questions in and we can take them as they come. Otherwise, we can keep chatting through here, but I just want to make sure everyone feels like that they can be heard so we can be as conversational as possible. So I'm curious, Brian, from your perspective, and I think we have a slide for this next question. Why is it important, do you think, to continue, like you just described, the symptom monitoring that you guys are working on, to continue this heightened system monitoring once, symptom monitoring once businesses reopen? What are all the different considerations that we need to be thinking about?
Yeah, I mean, this is what's dominating the news cycle right now, right? Which is we have seen the curve in most locations start to flatten. Some of them are still climbing, but climbing slower than they were. That's all because the only people who are out and about for the most part are people that have to be out and about. A lot of discretionary trips around town, a lot of gatherings of people being able to be vectors for the spread of this virus, have all worked together to limit how quickly everybody's contracting it. As we start to see people come back into the office, it's obvious that there will be more infections than there were when everybody was locked away in their homes. I think the other big thing to think about is for the people who have been self-isolating throughout the last couple of months, they haven't gotten used to all these mitigation things in the same way that people who are still working at the grocery store or serving as law enforcement officers or whatever roles are still out and about. Those folks have had the last couple months to get used to wearing masks everywhere they go and keeping their distance from other people. Just speaking for myself, my wife and I have not physically been in the presence of other people except for quick darts into the grocery store in literally 60 days. So I haven't had to wear a mask. I haven't had to worry about touching my face because I haven't touched anything except for stuff in my own house for the last 2 months. So as all these people start to re-enter the workplace, a lot of these habits have not been developed by those folks yet. So the hand washing, the distancing, the not touching things that you don't need to be touching, these are all behaviors they're just not used to doing. And so continuing both to monitor symptoms, but also continuing to reinforce all of these behaviors as people re-enter the workplace is going to be really important.
Yeah, some education there. It's interesting. I think we were, as a team at WELCOA, we were talking about, we went round robin and we're asking everyone at an end of day happy hour on Zoom, of course, what's the weirdest thing they've seen since the pandemic? And someone said they were in the store and saw someone remove their mask to sneeze and then put their mask back on. So it's like when you're talking about not used to wearing masks, like if you've been used to wearing it, it seems like a natural thing to do and you're going to use it properly. But if you're not used to having this thing on your face, are you like it's a great point, you know, that the reason why the curve is flattening is all of our behaviors, and as our behaviors change, that could change, you know, as well, right? Which I think people don't think about.
Yeah,
No.
one more one more thing I'll add to this thought is our role as employers is also to serve as another source of education for the people we work with. And just a quick anecdote, one of my own colleagues, and we are in the healthcare business, I was on a Zoom call with him last week, and as we were doing the start of meeting little pleasantries, he mentioned that he was a little tired today because his friend's birthday was the day before, and Wake County, North Carolina, had just allowed our stay-at-home order to expire because there's still a state order in place. So they were really excited that the county lifted the stay-at-home order so they could all get together and drink margaritas on Cinco de Mayo at his house. And I asked him if he had done any social distancing, if they were wearing masks, if they did it outside. Nope. He actually thought I was joking when I asked him. He was like, no, the stay-at-home order is done. And so the very next day we were like, okay, we need to get some re-education back out to our team because you know it's confusing for people. And you know, this is a college educated, very intelligent person who just wasn't able to track on it.
Yeah, just kind of focusing on the mandates more than the public health realities and safety realities, that these precautions, whether they're mandated or not, are really important to maintain, you know, to maintain our health. And it's easy to overfocus on the mandates, and when that's what the media is talking about. And that's what's felt like it's disrupted our lives so much. It's felt so forced on us, but maybe kind of practicing some of that and going back to that idea of collecting employee feedback. You know, we're not forcing anything on employees either. It's how do we get everyone to know that it's on them to keep themselves safe and others as well. Though we're all in it together, you know.
Definitely.
Yeah. So, you know, what are, and actually I did have a few questions I might just pause to direct to you, Brian, because I thought they were kind of time sensitive. You know, Kay is asking what the cost of that Validic symptom monitoring program is. And we are going to chat a little bit in a minute about the methods that employers can use to identify employees. I know that's kind of one of them. But yeah, why don't you speak to that if you don't mind?
Yeah, so our cost for that solution, it's very straightforward. It's a month-to-month contract. Normally, as a software as a service business, we need to sign longer contracts because we have to plan our business, but none of us knows how long this is going to go on, and we also don't want, you know, making a big commitment to stand in the way of using an effective solution. So it's a month-to-month contract. It's $500 a month for up to 500 employees, and then it's 50 cents a month for any employees beyond that first 500. So pretty simple, straightforward pricing. Most of that cost goes to cover the technologies we use to run the solution.
Great. Thank you for pausing to answer that question. I'll keep an eye on the questions box in case anything else comes in. So So the symptom tracking monitoring that you just described, why don't you talk about the method and other methods that employers can use to identify employees who may have COVID-19 or reduce the spread and severity of the disease? And specifically, how does, maybe since we talked a little bit about the solution, how is it deployed? How would an organization deploy this?
Yeah, so I gave the kind of high level of the types of metrics it tracks and the way we get it. So it just sends a text message to all your employees. They have that magic link that just gives them a really simple form to enter that information. The way we deploy it is really straightforward. You just reach out to us. We have a really simple, straightforward contract to cover that month-to-month setup that we talked about. We're not even doing like a first and last month payment. You're just paying for each month as you go. As soon as we have that contract, we stand up your deployment of the solution. We have the concept of administrators in the solution, as well as the monitors of the solution. So the administrators can then create the users who can actually access that panel and track all the people in your population. And once we do that, you can either invite your employees one by one in the tool, or you can give us an enrollment file that we just load everybody in at the same time. And all we need in that enrollment file is their name, their email address, and their mobile phone number. And then they will each receive an email inviting them to participate in the program. They will sign a consent. All the language in that consent form is customizable to our clients. Whatever your legal and risk team decides needs to be in there, it can say whatever you want it to say. And then once they've consented, they will start getting those text messages twice a day. And they can even pick what time in the morning and what time in the evening they want those texts. So if you have folks that are working third shift that need very different reminders than people that are working bank hours, they can configure all of that. So truly the setup is really straightforward. The one thing I would reiterate that we heard from Weaver Street and other clients is it is a really good idea before you go roll this out and everybody just gets these emails that you do some internal education or messaging to your team. So very similar to however you reach out to people about new insurance benefits or a new wellness program or other things like that, you want to probably do that first so they know it's coming. And then once they get that email, sign up is a 10-second process, and reporting twice a day is also about a 10-second process.
So important to set the stage for what's coming, right? Like that's the same thing. It's them understanding how it's going to be used, what the benefit is to them, whatever communication structure, like you said, that is already being used for any resource that's rolled out for wellness. This is no different, and obviously, I'm sure will increase the uptake. Well, both will improve employee morale around the product and the tool, and also increase uptake and engagement. So that's a great observation.
Definitely. One thing that we also recommend if you're doing a self-reporting approach, whether you're using our platform or not, sometimes there is a mismatch in incentives, right? If your company policy right now is that if somebody has symptoms that require them to stay out of the office, they have to use PTO. Well, now we have a mismatch in incentives on reporting accurately versus doing the right thing. And so it is still a good idea. You may not at that point need to do everybody gets a temperature check every morning before they're allowed to come in, but the team knowing that there might be spot checks from time to time helps really amp up the level of accurate reporting. I will also mention that when the employee goes to do that self-reporting, that form, every time they click submit, says right on the button, by clicking submit, I attest that this information is accurate and truthful, as another driver to incentivize good behavior. But a little bit of spot checking definitely goes a long way to make sure people know that we are following up on this stuff.
Those are great. Those are great observations, and we've gotten a lot of great follow-up questions. Again, asking to review that pricing, and I'm trying to respond in the chat for you guys personally. But would you mind just? I think more than one person have had that question. So would you mind restating the pricing structure again?
Yep, it's $500 a month for 500 users, and then it's 50 cents for every user over 500.
Awesome, thank you. Cool. So, I think this is kind of the thought that's on everybody's minds, and neither of us are attorneys, so huge disclaimer. I'm not, neither myself or Brian ever passed the bar, and we will not be giving any legal advice today, but it's a good conversation. I know one that's becoming, it's uncharted, I think, for so many of us. I mean, the last time that we faced a pandemic was over 100 years ago, and there is a precedent, a legal precedent for laws for us to be able to do things that during a pandemic that we weren't able to do in normal times. And so that's creating a lot of gray area legally, and there's a lot of questions and concerns about what's the right balance between, safety of employees and responsibility of the organization and what we're legally allowed to do. And I'm actually going to just really quickly send in the chat here. There's a link to a post that has some Q&A, and I know Validic did a blog recently that I think we're also going to share in the chat from your team, Brian, on that. And so for specific questions related to ADA, EEOC, even what's allowed under Family Medical Leave Act, how that's different. We have lots of different notes in there. But, overall, some of the conversation that we already had, I think, is still kind of the takeaway for me. And I actually got this from our legal expert that we work with at WELCOA at the Center for Health and Wellness Law. And our representative there said, there's no one that works for the EEOC or the ADA who goes from organization to organization to organization, sleuthing out who may be in non-compliance. But the way that these non-compliance issues arise is that they are reported by the employee. And you said it really well, Brian, at the beginning of the conversation. You said, if employees feel forced, they're going to turn around and act in direct response to that. But if they don't feel forced, if they feel like that they're being cared for, if they feel like that all of the policies and all of the precautions that are being rolled out are in their favor, then ultimately, if it passes the sniff test, most likely it's going to get through some of that gray area. But there's also some black and white. And so very much recommend that everyone on this call, if you have those questions, check out the legal resources that we're sharing. I'm actually going to share one more now from Validic here in the chat. But, consult your internal, legal team on that as well, because there's new precedents happening all the time and new mandates. So those two posts in the chat feature there should hopefully help with some of that conversation. But I don't know, Brian, if you wanted to add anything to that non-legal advice that I just gave.
Yeah, I'll tack a couple things on. The first is, as a company that operates in the healthcare provider and healthcare insurance space and frequently deals with the regulations of HIPAA,
Right.
One thing I do want to disambiguate for folks, and I think you'll read a little bit of this in the Validic blog post as well, HIPAA is only a governing set of regulations for healthcare providers, health insurance companies, and other companies that would be considered covered entities by the HIPAA regulations. So what you see here on the screen mentioning the ADA and EEOC, those are the governing bodies for employers who are not healthcare providers or health insurance companies or other covered entities. So, I often get asked when we're talking about what Validic does generally outside of even the COVID space, if I want to roll out a wellness program to my employees, what does HIPAA have to say about that? And HIPAA isn't really the governing entity in a employee wellness program. It is the ADA and EEOC. The other thing that I wanted to mention also, even beyond these regulations, which as you read both of those resources, you'll find the ADA and EEOC are actually fairly liberal with what you can do during a pandemic. But this was very timely. I read a blog post this morning. The American Medical Association published some principles that they think organizations that are not covered by HIPAA should still embody in the way that they handle health information during the pandemic. And a couple of points that they brought to the forefront I thought were very relevant here. Even there is a lot of can you and should you that you need to think about as part of rolling out your mitigations for the coronavirus. And one of them, the biggest one, is transparency. So any data that you're collecting from people, especially health data, you need to be very transparent with them about what information are we collecting, why do we need it, and what are we going to do with it. And that goes a very long way in both building trust as well as getting adherence. If people understand, okay, you need my temperature because that's one of the best ways for us to see who might need to be followed up with. Don't ask for information that you don't need. You'll each need to make your own decision based on all the published guidelines, but internal to our company, our recent conversation is 2 months ago, where have you traveled recently outside the US was a very relevant question. It's probably not now. The call's coming from inside the house at this point. And so, don't ask for information that you don't need. Be transparent about how you're going to be using that information. One of the other things that they shared was, and you'll see this in the ADA and EEOC, that data needs to be stored in a secure location that only the people that need to have access to it have access to it. All of those things come together to create a much higher level of trust with your employees. And in addition to all of the specifics and those resources that were linked, should keep you clear of any big issues.
Great, those are all super helpful clarifications, Brian. So we're running perfect timing we wanted to have 15 minutes or so for questions. So I'm going to ask everyone to direct your questions to the questions box, and we'll take those as they come in. And while we're waiting on those, Brian, just a question for you. As you're looking at all of the technology that's available, now that we, to help us manage workplace issues related to the pandemic from a safety perspective and beyond, always love to end, not that we're ready to end yet, but on a little bit of a hopeful note, what brings you hope in terms of what's available, in terms of how we can, see as we're moving into the fall and it's getting cold again and we could have these issues again, what are you seeing? What do you think is exciting about where we're at now as opposed to where we would have been 10, 15, 20, 30 years ago if this were to happen?
Yeah, I think a couple things. The first is, and I'll quote Andrew Cuomo on this, well, paraphrase anyway. I was watching his briefing a couple days ago, and he said, for the first time, at least in the state of New York, we feel like we're ahead of the virus. And what gives me the most hope is, though a lot of the things that we've had to do were very extreme, we have shown that we can control this and we can get the curve to bend. And that, if nothing else, is probably the most hopeful thing. We know what we need to do if we have to go back to extremes to stay on the right side of that curve. But I think the things that we can do today that if this were to hit 30 years ago, almost everybody's got a little computer in their pocket. And we can use that to both check in with them on how they're doing, as well as make sure that they have the information they need to make good decisions. We have the technology that, we've got 83 people plus us having a meeting, and we're all over the country. And that's not something that would have been quite so easy to do 30 years ago. We do have the ability to track the real-time updates that we're getting at the federal, state, and local level of where is the curve, how many new cases. All of that stuff would have been so much more difficult to track 30 years ago. So all of these tools kind of combine for us to be able to manage this in a lot more efficient way than maybe we would have 30 years ago. And obviously there's a lot of things that are still not perfect about what we're doing at every one of those levels, but I can't even imagine how much harder all of it would have been 30, 40 years ago.
Yeah, absolutely. All great observations. And I totally agree. I think even, I think your point about everyone having a computer in their pockets, well made. We do have so many more tools for communication than we've ever had before, and for getting information, but also the note about, access to this kind of conversation. We're able to collect questions from people around the country right now and have conversations with them in real time, whereas there would have been so much isolation before when these technologies weren't available. So I'm grateful for that too, that this hasn't created the isolation. There's still a lot of isolating pieces of this, especially for those of us who live alone. But this makes it so much more tolerable.
Yeah, let's also not forget Netflix and Hulu and all of those things to keep us entertained.
They need to keep releasing new series, that's for sure. It's a great time to do that.
Absolutely.
So we did have a question come in. This is about the case study example that you gave. What's been the feedback from employees? I don't know if you have much insight into that in regard to using that technology. I know you mentioned the communications piece up front, but any insight into how it's going, and then what the grocery store did to ensure that it was adopted?
Yeah, transparently, when they first rolled out the program, they did have a lot of employees that were a little bit skeptical. They acted a lot earlier, I think, than a lot of employers did, and so it felt. I think if they'd have started today, their employees might not have felt all of those same things. But early on, they were very much like, "Why do you need this information? What are you going to do with it?" All of the things that we talked about, and through the messaging that I shared earlier, and through them seeing how easy it was to do that reporting, they are now hearing more employees say, "Hey, I think this is actually, it's a good thing. It makes me feel better about going to work knowing that everybody else has done the same check-in. So I know that the people that I'm working with have also taken their temperature and checked all of their symptoms, and are letting the team know if anybody's having any issues." Fortunately, Weaver Street, and this is about as of a week ago, said that so far they have not had any cases emerge in their population. And they said, we really hope it stays that way, but it's nice to know that we have something that'll give us a very early heads up. So if we go from zero to 1, we don't go from 1 to 50.
That's amazing, right? So they really feel ready. They're in front of it. It's like they're waiting on the front line, just kind of with all the tools and resources they need. And thank goodness they haven't needed to employ them, but they will be able to. So another question. This is interesting. We were talking about education earlier. Do you know of any resources, and maybe, I don't know if you can speak to the symptom tracker that Validic has been offering, that you can add push educational messaging as well as inputs from the employee for tracking? Can you get both ways?
Right now, there's not a lot of stuff that we push back out. One of the features of the solution does allow us, if somebody doesn't measure or if somebody does ping above a threshold on one of those metrics, we can do a follow-up message to the individual, and that can be tailored by customer. So, one of the things that Weaver Street today is doing person to person, but could be using the technology to do, is if somebody does exhibit a fever, but maybe none of the other symptoms, somebody from HR is calling and saying, "Hey, do you have a primary care provider? If you don't, I can help you navigate our benefits to find a primary care provider and helping line that stuff up. But, as an example, if you post a fever, we could send a follow-up message that says, hey, here's some resources on our company intranet or our insurance company portal, whatever you want to direct them to. And that can be a timely resource rather than it just being on a web page with a bunch of other stuff.
Oh, that's a perfect way of using that. And really, with all the information, what I love about that and what's so cool about, using tech to scale out some of this stuff to your employees is that, all those messages are available. If you go read the benefits plan information one over here, you go to the EAP over there, or whatever it may be. But until it's relevant to the employee in the moment, they're probably not going to go out looking for it, and it might not even encode. It's not. We see so much information. If there's no relevant reason to remember, we might walk away and not paying attention to the message. But if you're like immediately, I have a fever. Wait, what do I do about this? And then you get the message.
Right.
The timely message can make a huge difference.
Yeah, absolutely. As the healthcare guy in my family and friend group, and as most of the folks on the call are the HR gal or guy, we're used to seeing how confusing this can be for people and all of the questions we have to answer. So the more we can deliver timely, targeted messages to people to get them to exactly what they need right now, especially during this time, is hugely helpful, I think.
Totally agree. There's another question, and we have time for one or two more. Have you seen instances where employers are providing their workforce with devices, so like thermometers, oximeters, and if so, how are they getting a hold of those?
Yeah, so like I mentioned before, those are a little hard to come by out in the wild today. Fortunately, at Validic, we have two healthcare device supply chain partners that we work with who are able to obtain those devices. So yeah, we do have several clients who are working with those partners to order devices. Those partners will either drop ship a whole pallet to you. So if you want to, like, if you run a factory and everybody's still coming into work every day, cheapest, easiest way is get that pallet and hand them out as everybody's leaving their shift and say, take this home, and this is going to be what you use to measure every day when you do your reporting. They also have the ability to ship to everybody's home. It's a little more expensive, obviously, to send UPS to everybody's house, but they are able to do drop ship to individuals as well for both those thermometers and pulse oximeters.
So that's helpful. It's so funny like, that we're having these conversations, right? I mean, it's like it's HR folks are having to deal with the procurement of these kinds of things that they probably never thought they would need to be smart about, but grateful that you have that information. I'm not seeing any other questions coming in, and I'm kind of wondering, Brian, if folks have questions after today, if they want to get connected, they want to learn more about the symptom tracker or anything like that, what's the best place to go to get a hold of that information?
Yeah, you can either email us at hello@validic.com, or if you go to that blog resource that was linked in the chat, that'll get you to our whole website, and there is a contact us section on the website. So either of those are perfectly great ways to reach us. That email inbox is very actively monitored, so we'll follow up with you really quickly. We'd love to have a follow-up conversation with anybody who's interested in some tools to help them get their employees safely back to work. And hopefully folks have found this helpful today.
Absolutely, I definitely think so. Oh, we did have one more question, two more questions at the buzzer that I think we do have time for. Terry wanted to know if you feel like in your experience so far, I know it's early days, is this a good solution for employers with fewer than 500? She's a smaller business.
Yeah, absolutely. Weaver Street, who I mentioned, they have 300 employees, and they're across 4 different stores. But whether you've got a team of 30 or 40 or a couple thousand or more, once you get beyond a handful of people, it's really hard to kind of keep track of what's going on with everybody. Validic is a 63-person company. We're all working from home right now, so we're not super actively monitoring our population directly because our office is literally closed and locked up. But as we start going back to work, we'll be using this to monitor our 63 people.
Awesome. You're also a client. That's great.
Yeah. Second time the hair club joke has come out in conversations.
Great. Another question's from Sam. Can you review again the process of the symptom tracker from like what's the employee experience?
Yeah, so I don't know how easy it is to pull your slides back up, but if you want to pull up the one that has that dashboard on it, it's kind of hard to see because it's little, but from the employee experience, once they've consented that one time, they'll just get a text message. That's the left screen on the phone there, twice a day. And it will say what you want it to say, but this one says something like, it's time to check in on COVID-19 symptoms. They click that link, and then they land on this page to the right, which also looks a little different because we have more symptoms we're tracking now. But they just enter what their temperature is, their SpO2 if they have a pulse oximeter. We have sliding scales to rank. Do you have coughing? Do you have shortness of breath? And then the other questions we've added around your heart rate. If you don't have a pulse oximeter, an elevated heart rate is a good proxy for you starting to have trouble breathing or getting oxygen throughout your body. So heart rate's another good metric that we're collecting. And then they just send it. So it literally twice a day, click, type, enter, and they're done. And then if you do engage those additional follow-up rules, if they entered a temperature of 101 Fahrenheit, they could get a follow-up text that tells them what to do next. And then all that data shows up on this dashboard for your HR team to keep track of.
Awesome. That is super helpful. Thank you. Hopefully that was helpful, Sam, answering your question. Well, Brian, this has been great. Always great talking to you guys. Oh, Sam says thank you. Always great talking to you guys and hearing kind of what you're up to, and just, just like, I feel like the great work that you guys have done getting this to market quickly and making it so affordable, and it's really for the greater good. It's kind of like, I feel like it's like similar to like, except this is actually what you guys do, but I was thinking about all like the breweries that are making like hand sanitizer now. It's like, it's like you adapt and you give the people what they need, and you guys were just like on it, and hopefully the folks on this call are able to take advantage of some of those resources, because I think that one of the things that you guys are thinking about, that we're certainly thinking about here at WELCOA, is not just now, but thinking through what's next, and what's top of mind right now is how do we navigate this return to work thing, and from communication to resources to information to tools like this one, all of this kind of stuff needs to be figured out still. So thank you for being so cutting edge and at the forefront of what people are going to need, and creating a solution that's ready to go whenever people are ready to get back to work. So grateful to partner with you guys to share this information with our folks. Thanks for being on the call today.
Yeah, thank you. Happy to chat.
All right, take care. Thanks everyone for joining.
Thank you all.